Hi FIGS! My name is Sabbaghzadeh and I am a registered nurse at Vanderbilt University Medical Center in Nashville, Tennessee. I just graduated from the University of Central Florida with my BSN and I'm still in my first year of nursing. I work on a transplant unit, so day to day I'm working with patients who are receiving transplants with their kidney, liver, spleen. And my unit also functioned as a COVID unit when cases were really high in Nashville. I love this unit that I'm on, especially as a new grad nurse, because it really gives me a broad patient population to work with. This is my pump up song for work. Love Beyonce. And along with this, I'm a certified doula, so I help women and their families through labor and the birthing process. I chose a career in healthcare because I knew I could make a difference in my patients' lives, and ever since a young age I found myself caring for others. Specifically, I have a passion for women's health, and I'll be returning to school to become a certified nurse midwife. Here's my little baby catcher in training bag. My hope after that is to work in a research hospital and then join the Peace Corps. Crazy thing about me, I actually don't like coffee. I'm the kind of person that goes to a coffee shop and orders a juice drink. I almost look at nursing as a way of life now rather than just a career. To me, being a nurse means being an advocate. It means being a healer. It means being compassionate. And it means being a friend to someone during what could be some of their hardest times. I really do love working with all kinds of people, but I believe I'll make the biggest impact in my community by working with women. I want to be a part of reducing the maternal mortality rate in African American women, and I want to make sure that my LGBTQ families aren't denied coverage by providers simply because of whom they choose to love. I want to ensure ethnic minorities are receiving the same quality care as anyone else. I want to be a part in keeping organizations such as Planned Parenthood open. So many young girls in our country are uncomfortable with their bodies and in their skin, and I'm going to help change this. One of the best ways to do this is through education, and even as a young nurse, I'm using my social media platform to discuss sexual health and pregnancy. I plan to continue to make a difference by having these hard conversations with women, girls, and their families. My hope is that in 10 to 15 years, I'll have made a positive impact on all the women I've cared for by empowering them with knowledge. I'll have taught young girls from underdeveloped areas how to have safe sex and the importance of their sexual health. I will have helped an enormous amount of families through miscarriages and failed pregnancies. The WHO is now saying that long-term effects of COVID-19 may be resulting in more stillbirths, and I plan on being part of this solution. I want to emphasize this last point. I'll continue to be an advocate for ethnic minorities and the LGBTQ community. I am inspired and motivated by my patients. Starting as a new nurse, I was expecting to do all of the teaching, but I was surprised to see that I'm learning so much more than I could have ever imagined from some of my patients. Working in healthcare requires commitment, and after working as a new grad through a pandemic, I can confidently say that I am resilient, but it is my patients who have shown me what true resiliency is. I did work to put myself through school. Unfortunately, I still had to take out a lot of student loans. Before I can go back to school to become a midwife, I need to finish paying off these loans. I worked multiple jobs as a nanny, and I also worked part-time at a children's museum. I have big plans to change the world. I just need a little financial help to get there. Thank you so much, FIGS, for this opportunity, and I'm looking forward to see who you choose as the new icons.